Let us look at aplastic anemia. Welcome to the third part of the anemia series, where we will be looking at the second type of anemia, which is aplastic anemia. This is when the bone marrow cannot make enough blood cells, therefore causing the blood count levels to be reduced. Okay. So what is the bone marrow? The bone marrow is that part that is inside, the inside of the bone. It is important because most blood cells, not all, but most blood cells are manufactured or made inside the bone marrow. And in our case, red blood cells are manufactured and they do mature inside the bone marrow. This is what the bone marrow looks like. It is important because most of the blood cells get produced in here, some of which do mature inside the bone marrow, but others mature elsewhere, like in the lymph system and so forth. So we look at the causes that could contribute to a person having aplastic anemia. The first one would be autoimmune causes, where the body's cells attack the bone marrow. It just happens automatically. The body just feels that the bone marrow is a threat and it attacks it. And then genetics, so the likelihood of a person developing aplastic anemia if their family member, father, mother, grandparents had it is high. Exposure to radiation lowers the immune system, including the viral infections. They also lower the immune system. And then medications such as Tegretol and Bactrim tend to inhibit the production of blood cells. How are we able to diagnose a person having aplastic anemia? So in the full blood count, which is a measure of all the blood components, this person will have something known as pancytopenia, which is a deficiency in all the blood types, right? And they will present with a low HB and a low hematocrit. And also a bone marrow biopsy will be done that will assist us in diagnosing this problem. Unique symptoms include bruising easily. When you get hurt, you just bruise a lot. Then bleeding gums because of a deficiency of thrombocytes or platelets. That means the blood does not clot that much. Recurrent infections, because we said that all the types of blood cells will be in deficiency. So that means the white blood cells are also deficient. The treatment includes a blood transfusion, which is when a client will receive blood to boost all the components of blood. There will also be an injection called erythropoietin. It stimulates the bone marrow to produce red blood cells. There's also bone marrow transplant, which is the transplant of another person's bone marrow. Thank you for watching, and I'll see you on part 4.